In this video, we're going to have a look at Exercise Management Assessment Task 4. Now, there's quite a bit involved in this assessment task, so make sure that you are covering each of the points and speaking with your trainer if you're unsure. This assessment task requires you to demonstrate your skills and ability to take 5 different clients through a fitness exercise process. All of these clients are going to be looking to improve function to prevent injuries. So for each of these clients, you need to undertake a pre-screening process. You need to undertake a fitness and health assessment. You need to undertake a functional assessment and gait analysis. You need to develop an exercise program that's specific to the client's needs and goals. You then need to instruct the exercise program and you need to reflect on it. So with client 5, you need to actually go through this process twice. So you'll need to undertake the reassessment and programming for client 5 again after 4 weeks so that you can monitor progress and make any adjustments to the strategy and program as required. So your instructor is going to provide you with the documents to complete this. It's also going to be attached at the bottom of this description so you can download it for yourself, and it'll be in a Word document so you can input it directly into the template. Be prepared, it is fairly lengthy. Your assessor will also observe you completing the screening process on one of these clients. When writing the programs, 3 of them must be designed as circuits, and the program should include a mixture of cardio, dynamic warm-ups and cool-downs, resistance exercises and/or flexibility exercises, as well as your injury prevention strategies. Modified program for the 5th client, so when you're doing that for the second time, it needs to address at least 3 of the following. So technical requirements, clients changing needs due to fitness adaptation. So because they've been doing this for a month, they may actually be stronger, or they may be able to perform an exercise for longer, have a greater endurance. Clients changing goals. So again, something that they may have really struggled with at the start, they might find easy, so now those goals are going to be changed. What the client's needs, objectives, likes or dislikes are. If your client is telling you that they really like an exercise or they really dislike an exercise, you want to try and accommodate for that because it's going to help them to stick with the program. And adjusting technical difficulty. The observation component of this will take time the observation part of this will take place at VFA at a time arranged by you and your assessor, and the assessor will try to make sure that you have all the resources required to complete this task. Your assessor will use the following rubrics when they're assessing you, so read through it all so that you know exactly what they're going to be looking for. Now if we have a look at the template that's with this, you'll see down the bottom it is 98 pages. Okay, so there is a lot involved with it. Make sure you are covering each of it. So it's got the description as we've previously discussed on what you need to cover, and it'll go through this for each of the clients. So with client 1, going through your health and fitness testing, so name, address. Now remember, we kind of need to make sure that you're not breaching any client confidentiality purposes with this. So I'm happy for you to use initials for the name and an address just put in a suburb. You'll need to take their blood pressure, you'll need to take some basic measurements and perform some fitness testing. Okay, so you need to identify what the test used was and what the results are when you've interpreted them. Any additional notes from the fitness testing and what the client goals are, and have them sign it, put their name in and date it. We also need to do a functional assessment. Okay, so going through different movements, identifying what exercise or movement test was chosen for that, what technique issues were established, was the reason for that a mobility, stability, balance or skill issue, and any equipment that you've used as part of this. Okay, so for a push exercise, we might be looking at a bench press movement. Right, so depending on what you've noticed when they're performing that movement, will identify whether there was any technique issues. So was one side of the bar lifting up higher than the other? Was the bar moving too far forward or too far back? So those reasons could then indicate whether it was a mobility issue, stability, balance, or skill. And any equipment that's going to be used, if you've done it on the bench, you'll be using a bench, and then whatever you've used as a bar. Now remember, we're not going for absolute max testing with this, so a lot of the time you will do it with minimal equipment, and it might just be a broom handle. So it doesn't need to be loaded up with too much weight. You then need to identify a reason for the functional performance issues with the exercise. So you might want to discuss in with this different things like muscle inhibition, strength, flexibility, muscle length, range of movement, things like that. You need to identify risks of performing exercises in this way if it was dysfunctional, and what some recommended exercise strategies are. So do you want them to be strengthening different muscles? Do you want them to be strengthening or stretching? And then you'll go through this for the different movements. So pull, a squat, a lunge, a rotational movement, an overhead press, overhead pull, and just making mention of if referral is going to be required with any of these as well. You'll then do a gait analysis, so looking at them through different parts of their walking, so what's going on right through their body during the different stages, so stance stage, swing phase, flight phase, and a double stance phase. So looking at them from an anterior, posterior, and lateral view, having a look what's going on with the foot cycle, so that foot strike, mid stance, and toe off. So even things like, is that step that they're doing even? Region-specific findings from the gaits of what did you notice at the ankle and foot, tibia, knee, pelvis, trunk, head, and arms. So even though we're looking at a walk, it's really important to still look at what's happening through the upper body. You then also need to create the exercise program, so put in what type of program type it is, what your warm-up exercises are going to be, and then your conditioning phase, so the exercises with sets, reps, rest periods, tempo, intensity, and duration. Listing some exercises to do as cool down and what stretches you would like them to do. So then you're going to go through the reflection stage of this. So list and describe 3 injury prevention measures that you implemented for this client. Reflect on your own performance through the fitness process and how do you think you performed and what changes would you make. Then we'll go through this for client 2 through to 5. If we go down a little bit, you'll then see we've got client 5 reassessment. So you would have done client 5 just previously, and then you go through everything again to see how they're progressing through it. When we get down to the bottom, our questions are going to be a little bit different. So what feedback were you given by the client and how did this influence the reprogramming? Did you require any assistance from another allied health professional through the process? And if yes, what advice or assistance was provided? Discuss the changes that you made to the client's program in relation to the results you monitored through the reassessment. So remember, this can be improvements in their strength, improvements in their flexibility, or even just being able to achieve simple tasks. Reflecting on your own performance through the exercise programming component of your course. So were you confident in it? Right? Were you able to pick up issues when you were doing the assessment side of things as well and be able to copy them over to what you're putting in your program? What changes did you make to your own professional practice or instructions? How did the changes established in question 5 above assist your clients? And describe 2 areas where your skills could still develop in the area of exercise programming. For each of those areas, you need to describe the professional development you intend to take to improve in this area. So every component will have reflection questions, but it's also going to have the testing components. The other thing you are going to need to do, which isn't attached in these documents, but you will need to undertake a pre-screening process. Now, depending on how you go about this can either be the pre-approved Part Q that Fitness Australia provides, or you can use your massage client intake form. Either of these will be accepted as pre-screening processes. Once you've completed this document, you will then just need to upload it into your assessment task.